Hi everyone, and welcome to another episode of the Fibroid Doc. Today I'm going to be talking about uterine cancer and cervical cancer. As we wrap up September, which is GYN Cancer Awareness Month, I'll use the next 5 minutes to discuss the most important factors about these two types of cancers. And if you haven't watched my previous video on breast and ovarian cancer, make sure you do that and also share with a friend. Okay, so let's talk about cervical cancer. Now, cervical cancer is pretty rare in the US. 85% of cervical cancer diagnoses worldwide are made in third world countries where screening is not yet prevalent. Now, speaking about screening, cervical cancer, for cervical cancer, the screening test is a Pap test or a Pap smear. This is where your OBGYN or your internist or family practice doctor takes a little scraping around the cervix, takes those cells, and then it goes off to the lab and they look under a microscope and check for any abnormalities. So there is a screening test for cervical cancer, and that is the Pap test. The second point is cervical cancer is caused by HPV or human papillomavirus. Now, this is a sexually transmitted virus. That's the only way you can get it. And this is responsible for many of the various types of cervical cancer that women get. The third point to remember about cervical cancer is that it is a very slow growing cancer. It takes about 15 years from the moment you get HPV to actually getting the cancer if you do nothing in between. So, and that we know that that's not often the case. Most women are going to see a doctor, they're getting those Pap tests and getting regular screening. So if the disease is progressing, we're treating it, early on before it becomes an issue. But these are the most important things to remember about cervical cancer. I will talk later about the HPV vaccine as well, which can help with some of the strains of HPV, but not all. Let's move on to uterine cancer. So uterine cancer or endometrial cancer is cancer of the uterine body. And this is a cancer that is often diagnosed above age 50 in white women. And there are some risk factors such as obesity and diabetes. The second thing to remember about endometrial cancer is that it often, the biggest risk factor is actually unopposed estrogen. So that can be women who are taking estrogen without balancing it out with progesterone, women who are obese, and so extra fat cells or adipose cells get converted to estrogen and then act on your uterus and can cause precancerous cells. Another thing about uterine cancer is that 10% of it is genetic. So 10% of uterine cancer is genetic. It is related to other cancers such as colon cancer as well, and sort of occur in groups. But most of it, they're caused by risk factors that are modifiable by us. So I would, if you have some of the risk factors that I mentioned, diabetes, obesity, I would definitely see what's one step you can take today to help reduce your risk for endometrial cancer. And lastly, with endometrial cancer, abnormal bleeding is one of the most common symptoms, whether that is before or after menopause. Okay, so before menopause, if you're somebody who's bleeding really heavily, you're 45, you're bleeding really heavily, or your periods are all over the place, your doctor may often want to do an endometrial biopsy, which is a diagnostic tool to detect endometrial cancer. And if you're after menopause and you spot or you bleed, you also want to make sure that you get checked out and make sure that you have the biopsy or ultrasound or something to make sure that you don't have endometrial cancer. So those are my most important kind of pearls about cervical cancer and uterine cancer. Please tag a friend who could use this information. And again, if you haven't watched my video on breast and ovarian cancer, make sure you do that as well. Okay, I'll talk to you later. Bye.